Good afternoon, everybody, and I'm here speaking on behalf of all the members of the UHC 2030 globally, and many of them who are here with us. And thank you, Ambassador Besha, for hosting this, and for everyone who has commented. And I want to thank all the members of UHC 2030 who have participated in the process, which has resulted in these high-level 6 key asks. And also my co-chair, Ilona Kikbuch, who is unable to be here, so I'm representing her as well. I will start off with a very personal story. My father passed away in November 2016, and he passed away at 84. And when he passed away at that point, he could not afford he could not get health insurance despite the fact that we could pay for it. And the reason was, one, he was above age and the National Health Insurance Fund was not adequate for him. So I remember in his last admission before he passed on, we admitted him in a private hospital, and a few days later I got a call from the nurse saying my father has refused to eat. And he hadn't eaten for 2 days. And when I went to talk to him, the reason he gave me for not eating is because he had been admitted severally, and he started to feel that the amount of money I was spending on his admission was too much, and he started to feel that actually he's taking money from his grandchildren, who are my children, and therefore he thought that if he stops eating, he'll reduce the bill. This is the reality that we face out there. So for me, to have been appointed co-chair later in 2017, it was a personal journey, not just something that I had to do, but something I live every day. Today we are presenting to you the key asks from the UHC movement on moving together to build a healthier world. The high-level meeting, which is coming in September, is a major opportunity for us to mobilize the highest political support for UHC as a cornerstone for achieving SDG 3, but also as a key pillar for peace and prosperity for all people of the world, knowing also that within the SDG framework, we've said no one should be left behind, and knowing that health is key to economic prosperity that we want to achieve. The UHC 2030 comes here as officially mandated through the UN modalities to assist the UN high-level meeting preparation process with a focus on sharing evidence and good practices, challenges, and lessons learned. And the UHC 2030 represents a multi-stakeholder platform that promotes collaboration on health system strengthening at the global level and includes government constituency, private sector, includes civil society, academia, the youth, and therefore it's an extremely important platform to mobilize inputs towards this political commitment and facilitate accountability and promote knowledge sharing for stronger, sustainable, and equitable health systems. You can read, the necessary resolutions in the documents that are provided. I just want to say that to get to this level of the 6 high-level asks, we started the process by launching an online survey, and out of that survey, we received over 260 online survey inputs. On top of that, we had a lot of written submissions from civil society, from youth across the world, and we also had multiple multi-stakeholder consultations starting from January and ending in March. And some of those included private sector consultations, academia and practitioners, health system networks, parliamentarians, youth, civil society, and communities. And finally, we distilled the key contributions and inputs, and we then held a steering committee meeting last week that had a consensus on the key asks that I'm going to present to you today. So where are we now? We are now at the level of presenting this to you and launching these key asks. So these key asks have gone public today. We also have people who are listening to us on live stream. These key asks can be found on our website, but today I'll just give you a very high-level overview. And these key asks are going to be input into the process, and we are looking forward to this being part of also the consultations that are going to happen during the UN multi-stakeholder hearing that is going to be on 29th of April, and many of us here are registered to attend. and we hope that we'll contribute significantly with the assistance of the co-facilitators who are represented here to the draft UHC political declaration, which is going to be finalized somewhere in the Q3 of 2019. So today we are presenting, and we're really grateful to the group of friends, which is chaired, facilitated by Ambassador Besho, which is going to really help us to input these key asks to the member states for their deliberation and eventual output. So I know there are we have 6 key asks, we have 6 milestones, and we have 36 action agenda items. I will not go into the 36 agenda items because time doesn't allow, but the brochure that has been provided to you on the table has the key agenda items. So what I will do is just highlight the key asks and the 6 milestones, and I have someone helping me to go through that, so I'll very quickly go through the first one. So the first key ask is to ensure political leadership beyond health, recognizing that commitment to achieve UHC for healthy lives and well-being for all at all stages is a social contract. And health is the foundation for people, communities, and economies to reach their full potential through shared prosperity. And UHC is recognized that is primarily the responsibility of governments, which ensure people's health as a social contract. And that achieving UHC is essential for inclusive development, shared prosperity and fairness, and requires political decisions, which is why this is important and goes beyond the health sector. The milestone for this particular key asks is that by 2023, governments will incorporate aspirational health-related SDG targets into national planning processes, policies, and strategies to ensure everyone can access quality health services without financial hardship. The next key ask is leave no one behind. By pursuing equity in access to quality health services with financial protection. We recognize that health is enshrined as one of the fundamental rights of every human being. And UHC, as I've said earlier, is key to reducing poverty and promoting equity and social cohesion. And governments should invest in everyone's health. That extension of geographical coverage and reaching the most marginalized and hard-to-reach populations are essential to achieving positive health outcomes. And a strong health system for monitoring and evaluation is needed to ensure accountability and participation. And for this particular key ask, the key milestone is by 2023, governments are able to report disaggregated data to SDG official statistics to capture the full spectrum of equity dimensions of UHC. Key ask 3 is to regulate and legislate, creating a strong enabling regulatory and legal environment responsive to people's needs. And because we know that UHC requires sound legal and regulatory framework and institutional capacity to ensure the rights of people and meet their needs. We know that governments are the primary duty bearer under the International Covenant on Economic, Social, and Cultural Rights, and even in cases where they rely on private sector, governments are the primary duty bearer. The milestone for this ask is that by 2023, governments introduce legal and regulatory measures that accelerate progress towards UHC. Key ask 4, to uphold quality of care by building quality health system that people and communities trust. Quality primary health care is the backbone of UHC, as has, we made reference to the standard declaration that primary health care is the backbone of UHC and creates trust in public institutions, and that expansion of health coverage must be accompanied by investments in the quality of health services. We have evidence that quality must go hand in hand with access, that people should be able to access a full spectrum of safe quality services and products in their community, delivered by well-trained, well-paid, and culturally and gender-sensitive health workers. The milestone for this key ask is that the coverage of quality essential health services has been delivered to 1 billion additional people by 2023. Key ask number 5, that we invest more and invest better. We must sustain public financing and we must harmonize health investments. Current funding levels are definitely insufficient for us to achieve UHC by 2030, and governments need to increase domestic investment and allocate more public financing for health through equitable, mandatory processes. And we are clear on that governments must improve efficiency and equity and the use of existing resources and reduce reliance on impoverishing out-of-pocket payments. But further to that, development assistance to health should reduce fragmentation and strengthen national health financing capacities. And this is in reference to the Global Action Plan, which has just been made reference to by WHO. And by 2023, governments should adopt ambitious investment goals for UHC and make progress in mobilizing domestic pooled funding and reduce both catastrophic and impoverishing expenditure. Finally, ask number 6, that we must move together. We cannot do this if we don't move together. And therefore, we call to establish multi-stakeholder mechanisms for engaging the whole of society for a healthier world. One, that all countries must take active steps to meaningfully engage non-governmental actors, particularly unserved, underserved, poorly served populations in shaping the UHC agenda. That solutions for each country will be tailored to their context and population needs. There's no one-size-fits-all, and that the international community and global health partners should unite to support countries to build a healthier world. The milestone here is that all UN member states should endorse the UHC 2030 Global Compact and establish multi-stakeholder platforms to ensure the involvement of civil society, communities, and private sector in regular policy dialogue, meaningfully, and review of progress with all government actors. These are the asks for the high-level political declaration in September from UHC 2030 constituencies for moving together to build a healthier world.